Are you getting new patients and feel like you're not getting busier or your hygiene department's not growing? Good. Stay tuned for this week's tip and we're going to handle it. Hi, my name is Jeff Santone and I'm a senior seminar speaker for MGE. And if you haven't watched my previous tip on active chart versus total chart, I would suggest you do that because we're going to use those numbers now to calculate an attrition rate. I meet with many doctors, and in that previous tip, I would say that a lot of them are busy. They're getting 20, 25 new patients a month, 30, 40, 50, and their hygiene department has not grown. They haven't added a single day of hygiene in the past year. And to me and to you, what that means is for every new patient that came into the office, it means that I lost an existing patient. And we're spending a lot of money, upwards of $250, maybe even $500 per new patient to be acquired into the office. So with the numbers that we got out of the previous tip, you can start to calculate an attrition rate. When you downloaded that data, patients last seen 5 years ago, 4 years ago, 3 years ago, 2 years ago, what you're going to get actually is an attrition rate. Any patient in the category of 5 years ago, that means that the last time they were seen was 5 years. That means they're gone. So let's just say for fun that when we calculated our total number of charts 5 years ago, we had 5,000 charts total. If I also know how many new patients that year I received, let's just say I was getting 50 a month, so I got 600. So if I'm getting 50 new patients a month and my total new patients for that year were 600, and then if I could isolate all the patients that were in 5 years ago, last time they were seen was 5 years ago, and I calculate that number was 500. That means I only had a net gain in the previous year of 100 patients. And this is why hygiene departments fail to grow. 100 patients over the course of a year isn't enough to handle the cancellations and no-shows that are going on and to make the hygiene department grow. So we stagnate. We think that we're not busy and we always need more new patients. And that's just not true. If you start to look at those differences between year 5, 4, 3, 2, 1, and you can also calculate how many new patients you got, you start to see how many patients you left, how many just didn't come back. And there's a lot of reasons for that. You know, there's deactivation reasons, and you should check out our tip on when to deactivate a chart. But the most common reason that I find is that most areas and most practices, most areas of the practice are just satisfied that hygiene's full. You know, we have a full-time hygienist and she's here 4 days a week, 5 days a week, or he's here 3, 4, 5 days a week. We're full. We've always been full. And that's a good thing. But we don't notice this attrition rate. So what I want to talk a little bit about right now is reactivation of those charts. Your best source of new patients are patients that haven't been in for a while. And the best thing about those patients will be that you know where they live, you know what type of work they need done, you have an email address, and you have a phone number. That's better than any new patient coming in. So you should be attempting to reactivate those patients by contacting them, marketing to them, sending them information, and not forgetting about them. The more times you're in front of those patients, the more likely it is that they've come in. We've all had the patient who we swore moved away or left or passed away, and they haven't been in to see us for 5 years. And they walk in the door, and we ask them, you know, did you get my emails? Did you get my phone calls? Did you get my texts? Did you get my letters? And they say yes. And you're like, okay, you know, like, well, how come you didn't respond? And they're like, well, nothing hurt. And what are you doing here today? Well, something hurts. So always stay in front of your patients, always mail to them, always stay in contact with them. It's the best way to come in. And we do have a reactivation program here at MGE. If you'd like more information on it, please give me a call. My name is Jeff Santone, and the number here is 800-640-1140. If you like this tip, hit subscribe, click the subscribe button below, and click the bell so you get notifications. Otherwise, stay tuned for my next tip. Have a great day.